Well, exercise prescription for neurological diseases. Well, actually, as I mentioned earlier, like 10,000 years ago, millions of years ago, this was the process. Actually, we were hunters, like thousands of years ago, we are running, and now we are actually converting into a more sedentary life. And the studies conducted showed that in the neurons of the brain are specialized in some regions, and there are connections. And actually, as your expertise and your work increase, the corticospinal pathways are increased. The more they increase, and then the neuronal actually network is more developed. And well, actually, if I tell this speech by walking, then I can focus on better, because it's about the connectivity in the neurons. As the connection increases, my executive functions are also increasing. And on the molecular level, between the neurons, this is the movement signals, and with the synapses, they have a different connectivity rates. And this requires memory. As the memory is activated, and as you repeat, the number of synapses and the connection is actually increased. We have some traumatic brain damage or external sources. Maybe there are some accidents and stroke, and it might be lead to an embolic hemorrhage. And in all of these, speaking, moving, and executive functions are delayed. In the spinal cord damage, and from the region that the damage is seen, there is a paraplegia, and there are some pain, and inability to move is seen. And after the stroke, we have some losses on the motor functions. After months of the stroke, even the patient is good. The patient can actually experience some imbalances. There might be some paraplegia, and actually this causes an additional need for being able to move on their own by 30%, and in the 16% of the patient needs institutional help, and actually there are some losses of employment after the stroke in 71% of the patient. And below the age of 65, there are some unemployment cases by actually 34%. And what is a recovery mechanism? And there are two mechanisms of recovery in the neuronal situation. The first of them is recovery on its own, and the other one is with the active learning process. The recovery is seen, and there are some systems included here. In the neuroplasticity, in the damaged region, for the synapses to be reorganized is needed, and in the damaged region, after the loss, in a closer region to the damaged area, the actually need for regaining its function is needed. And on the early period, the repetitive movements on the forefront. And in the neuroplasticity, actually it's the skill of the neuronal system to have a response for the external stimulators. We know this concept for 15 years. In the damaged neuron, we thought that there would be no recovery, but this molecular studies indicated that the presence of the neuroplasticity is defined. This is a study, a damage related to stroke. In the patients like that, fMRI is applied. There is the rehabilitative ones and the non-rehabilitative one. In the if we do some aerobic exercise during rehabilitation on that group, in the post-infarct area, the replacement there is wider and it's earlier. So this is from Rize. This is our region, and it showed that your neuroplasticity is increased when you look at the green place in the nature. What are the key factors in neuronal recovery? Nick Cavell is a neuroscientist from Oxford. He says that if exercise were a pill, it would be one of the most cost-effective drugs ever invented. Well, it's true. So when we look at the benefits of the exercise, it's unbelievable. In the organ systems and on the molecular level, it has various benefits and advantages. It reorganizes lots of systems. What are these? It provides angiogenesis. With a regular exercise pattern in the brain and in the other organs, there are some new vascularities. In the neural network, in the damaged region, there is an increased rate of neuroplasticity, and in the normal people, between the neurons, the connectivity is also increased. In terms of cognition, there is a severe positive effect. And this actually a meta-analysis study indicated that in the 60,000 people, the mild exercise, moderate exercise, and dance exercise groups were followed up for 20 years, and it showed that the moderate and the dance exercise groups have less risks of disorders, and exercise also anti-inflammatory, anti-apoptotic, immunoprotective, and neuroprotective effects. So, if it's that beneficial, if it's advantages as a drug, how should we administer? How should we prescribe these exercises? The density, the severity, the frequency, and the type of the exercise should be included in the prescription, and it should be done on the basis of that individual. And the study actually searched for the relationship exercise and longevity. This is my patient. He had actually a drowsiness. He was 100 years old. He was very healthy. And the studies also showed that the people want longevity and they want to age successfully. So how can we reach this? If you have a good sleep pattern, if you are active throughout your life, if your social integration is rich and wider, if you have an active life, if your nutritional pattern is like Mediterranean diet, 3 or 2 meals a day is ideal. And if your BMI is between 18 and 25 throughout your life, then in the long term you deserve to live longer and successfully. And when we look at the studies, I mean, the 40-year-olds and the regular exercise groups were compared, and it showed that the ones who exercise at the age of 70 are more healthy when compared to the 40 years that have a sedentary life. And you can see this woman is obese, but after the age of 56 she starts to do exercise, and she actually is a champion, and actually she is in the Guinness World Record. Well, actually age is not a limit. Actually you need to make life interventions. And studies also indicate that after starting to exercise, if you feel better, and it actually there's a decrease in your loss of performance, your immune system is corrected, and there are also immunoprotective effects. Your blood pressure is on balance, and actually it has a positive effects on pain pathways. If there are severe pain patients, the studies indicate that the exercise secrete endorphins, and they have positive effect on pain pathways. And at the same time, with the exercise, your telomere length is prolonged. You actually decrease the shortening of that telomere, and the performance is also increased, and actually you change your destiny of your cells. I mean, if you decide on to do life interventions, and if you get the vitamin supplements like omega-3s, for example, then it changes your telomere structure and it prevents its shortening. And on the molecular level, I mean, we have some neuron-based factors, and we have some glial factors, and they are all increased. And there's an increase on the hippocampus. In the gyrus we have an increase. The hippocampus is related to the memory and executive function. So the more you move, the better your memory will be. And the studies also indicate that if people with aging stop exercising, then actually the late onset causes disorders. I think this is an interesting study. Maybe exercise actually corrects and prevents lots of things in our life, and it prevents the possible morbidities. The studies also show that in the mild or moderate exercises, and in general the moderate exercise is suggested, and it increases the cerebral blood flow, and it regulates the blood pressure, and the carbon dioxide usage is also consumption is also increased. And the neurotropic factors, the effect of neurotropic factors were evaluated. If you do a moderate exercise pattern, it has good effects on the peripheral and central nerve system. And well, this is a rat study. The sciatic nerve of that rat is damaged, and then the rat is doing exercises after that, and after the exercise the frontal horn and the posterior horn actually assess 4 factors, and after some degree the results are positive, especially in terms of growth factors. There's an increase in growth factors. So what about our neurologic diseases, especially for Alzheimer's, stroke, and Parkinson? There are lots of studies, and as you all know, the Parkinson and Alzheimer actually do not have a precise cure. We can only proceed with the palliative care. We can only increase its comfort, but maybe with exercise it can be prevented and damage can be reversed. So how is the effect mechanism? It decreases the neurotoxic effect. In the Alzheimer and Parkinson disease, and in the major depression partially, it's a neurotransmitter disease, and dopamine, serotonin, and norepinephrine levels are changed. Maybe it's like having a little bit Prozac and having a little bit Ritalin. It increases your attention and it makes you a little bit happier. And what are the effects? It's from the dopamine and serotonergic pathway. You feel motivated, you feel better, and actually it also increases the antioxidant effect, and there is a glial-based neurotrophic factor increase, and the neurogenesis, angiogenesis are also promoted for cell formation. It's actually strengthening the networks, and it also increases the auto-control. You can have better performance in your daily life. It increases the cognitive function, and that's why it increases your quality of life. So what about epilepsy and physical exercise? Well, they have a special condition, and that's why aerobic exercise actually is recommended, but in the vehicles, in swimming and in maybe risky sports, they need to be very cautious. And what about exercise and neuromuscular disease, especially in terms of ALS? We don't have a very precise treatment. The neurodegenerative structure is decreased with exercise, and especially aerobic exercise and resistance exercises are feasible in our patient group, as the studies indicate, but all of the recommendations actually say that the patients should be evaluated by a cardiologist primarily before the prescription. And sometimes there are some coexistent diseases. Maybe the patients should start exercising after getting the medications at first. And what are the key factors in terms of rehabilitational effect of exercise? And they are all related to the situation of that patient. In terms of density, group exercises are very effective, and the patient actually sees the effect by themselves. And in terms of exercise, it's actually based on that individual. Before the exercise, the prescription of the exercise should be written as what are the tasks, what are the variations, and what is the expectation from that treatment should be written.
The frequency of exercise, the repetitions, the duration are crucial. You have to start with warm-up and then do 3 sets, and then depending on the situation of the patient, make sure that you select the most useful exercises, because there's postural instability in some patients, for example, and imbalance might be a big problem for some neurodegenerative patients. You have to focus on balance. So our patients need to be given Madopar preparates. So 45 minutes before the treatment, Madopar preparates should be given to these patients, administered to these patients. As I said, the exercise needs to be performed under the supervision of a physician due to its duration, frequency, and repetitions and sets. So once more, because we have to say that a healthy life and managing stress correctly, enjoying an active life, and improving the education level increases the neuroprotective level. For that reason, risks that could be modified should be combined with genetic, lifestyle changes and other factors to improve the situation of these patients. The photo on the left is a painting taken from or painted by the Harvard students. People are having a meeting on treadmills, so maybe that will be the future. The book on the right is for psychiatric, neurological and physical therapy patients. Exercise prescription is explained in detail. This is the Kachkar State Hospital where I worked previously. Parkinson and stroke patients were given 45 minutes of Pilates and aerobic exercises for 45 minutes per week for 3 days a week. All patients were evaluated for their cardiac reserves, and depending on their disease they were told when to come and how long they will do these exercises. And we started with a group therapy, and a Pilates coach from the State University and also physical therapy department worked together with these exercises. And in fact, these patients, especially in Parkinson's patients, we have seen improvements in the depression scale. For example, they performed better. And this is the Darul Ajaza. It was established 120 years ago. It was established for neurorehabilitation. If you haven't been there, I definitely recommend you to go there. For mental and neurodegenerative diseases, it's a place for any people, for all people, depending on all ages, all social areas, all religions. There's a mosque, synagogue, and church in it. Probably the first rehabilitation center that actually provides all these. And Hippocrates has said that if you're in a bad mood, go for a walk, and if you're still in a bad mood, go for another walk, he said. You have to go and take a look in the past then. Okay, thank you very much.